Hi. At around 17 months, I started to notice how my child was not responding to his name, how he was not looking at me, how he was not doing other things that his age-appropriate children were doing. I went to a lot of doctors, I asked around, so many things popped up on Google. Finally, we decided to shift to Bombay to show it to a better doctor. Showing him to the doctor, I ended up with Franzina. Franzina was like a God-sent angel for me. She told me what was his problem, what was his diagnosis, what can be done. I've been doing therapy with her for around 4 months, I can say. My child has got his social smile back. He is responding very well to his name. He looks at strangers. He wants to initiate play. He has started crawling, which he was not. There's so many little things which he was not being able to do that he is starting to do, though I know that there's still a long road ahead. But therapy has really helped him. Franzina has really helped him. She gave me an awesome home-based program to do, things to do at home. She was just God-sent for me, and I strongly recommend all the mothers out there that it's okay if this happens, though you must be overwhelmed with a lot of questions and answers. But occupational therapy is one way to go, and Franzina is an amazing therapist.
I'm a mother of a 2-year-old boy, and when he was about 18 months old, he was suspected to be on the spectrum because there was a speech delay. And that's how I started Vivan's therapies, which included OT and pre-learning skills. And within a short span of 1 week, we noticed so many changes in him that it's very difficult to explain it in words, because he started interacting with us. In the span of just 1 week, we saw that his eye contact improved. He started taking an interest in people a lot more, and now it's been close to like 7-8 months, and it seems like that he's a different child altogether. In terms of his behavior, now his social interaction is wonderful now, as opposed to before therapies. Now he wants to be with people. He wants to be with children. Now he knows how to play with them, how to interact with them. Earlier there was no speech per se, just barring like few words. Now he has 2 to 3 word sentences, and he's now he's age appropriate in terms of his speech, in terms of his mannerism. By and large, he's age appropriate. Recently we had taken him for an assessment, and there we figured that he doesn't qualify for the spectrum anymore. So what happens is, in our country there is not too much awareness of this problem. Because of that, there are a lot of questions that we have, and very few people who are there to answer. Because of that, we just keep reading up on net, and there's so much information on the net, but it's all there's too much to read, and the information is not filtered, so sometimes you don't know what will work for you and what will not work for you. Because of that, there's a lot of confusion. So in my case also it happened the same. And when I came in, when I started my son's therapy with Franzina, I had a lot of questions, and she answered all my questions, and she explained the condition to me so well that earlier the behavior which we thought was weird, we realized that it's not weird. It's there was a reason why my son was doing certain things, and after knowing the reason, we were able to deal with it much better.
I'm a mother of 4-year autistic kid who earlier, before coming over here, he used to roam here and there. He never used to sit in one place. It's almost 6 to 7 months I came to this center. He has calmed down a lot. He does his work, concentrate on his work a lot, and especially his eye contact. He never used to give proper eye contact earlier, but now he gives very good eye contact also, and he always used to be in his own world. Now he concentrates and listens to his name also. He never used to pay attention. Whenever he used to call his name, he used to see somewhere else only. Now he pays a lot of attention. His attention is increased. He finishes his work. Once he takes his work, then he finishes his work also. And his sitting posture increased a lot. He never used to sit properly. Now the way he sits is too good. You can say 70 to 80% increase in his way of sitting also. Within a span of 6 to 7 months, I think he almost 50 to 60%. There's a lot of improvement has come in him. She had given me the way of exercising at home, and home programming used to be there. His stretching of body, how I used to do, and sensitivity, because these kids are very much this thing for any sensory thing. They like to touch the floor, touch the wall, whatever the texture. So she had asked me to do different texture this sensory this thing. Even she asked me to give the massage also, how stretched one, and many things at home. She asked me to do his mouth exercises, because he used to babble a lot. I mean, not exactly babbling. He used to remove his mouth. He used to do that. Not anymore. His eye streaming was there a lot because of her whatever guidance she had given. It decreased a lot. He used to bite his nails also. Not anymore now. You might have seen him. He's not doing anything that kind. He improved a lot. No, actually, other people cannot make out that he is an autistic kid. After a long time, they come to know, okay, he's something different kid. My advice for all the mothers, actually, especially, they should not feel that autistic kids are a burden on them. God had made mothers specially for the specially autistic kids. Only mother can improve them, whatever things, because other kids, they look at other people and they learn. But in autistic kids, mother is the only person who can teach the kid from the scratch, actually.
So my name is Franzina Coutinho. I'm a pediatric occupational therapist, and I've been practicing for over 15 years now. I've been working with kids, and that's what I've wanted to do since as long as I could remember. I deal with children who are on the spectrum, children who have learning difficulties, and sometimes who have language and speech delay. And the primary two areas or types of intervention that I use are neurodevelopmental treatment and sensory integration. So in combination they work fantastic based on the need, but with kids on the spectrum, sensory integration is primarily what I use. And my way of treatment is a little different, where I do short spurts of it followed by some type of sit-down task. So as a therapist, I think over time, a few things that have made the biggest difference to my practice are getting the parent involved from the get-go, explaining to them, no matter how uneducated I want to say you think the parent is, they have the best interest of their child at heart. So trying to break it down and explain to them what's happening, that there is hope. If there is hope, I mean very often there is, you can make a difference to their life, and give them appropriate things to do at home, understanding what capacity is for the parent and the child. I think these three things I've learned as a therapist over time, and that's what I think the next generation of therapists need to be taught as well. I learned the hard way, but it would have been fantastic if somebody had told me this when I started off myself. But it does make a difference, and a parent, no matter what you think of them, really wants to make a change to their kid's life and will do whatever they can. So I think a little guidance and a little hope in combination make a big difference. Yeah.